There's a disease that travels in dusty, dry conditions. The CDC reports the most common way to get it is by breathing in a fungus found in desert-like soils.
It's called valley fever, and it's mainly been a concern in Arizona and California. But research predicts affected areas will more than double by the end of the century.
We have an in-depth look at who's at risk and how doctors are training to spot the disease.
I got sick from dust. Essentially, what is dust?
Jeff Weinbrenner moved to Arizona in 2012 as a young, healthy teacher. But shortly after, he fell seriously ill. He couldn't walk, had IVs around the clock, and even lost his hearing.
I didn't do anything wrong. I breathed air, and that got me really sick.
Weinbrenner credits a doctor's diagnosis with saving his life.
Luckily, I had a very experienced doctor who tested me for valley fever, and it was.
Valley fever is a disease caused by a fungus that's mostly found in hot, dry environments like the American Southwest. It can get carried around in dust. Many who do get sick don't need medication. The California Health Department reports 60% of those infected with valley fever never even know they have it. But for a rare few, like Weinbrenner, it can be devastating. According to the Centers for Disease Control and Prevention, about 20,000 cases are reported each year, and about 97% come from California and Arizona. But a 2019 study in the journal GeoHealth projects valley fever could spread east through the Great Plains and north to the Canadian border in less than 75 years.
What's concerning is, as the climate is getting hotter in certain areas, that fungus is potentially spreading further out, and so more and more people are at risk.
Dr. Sarah Parker with Carius, a company that tests for infectious diseases, believes awareness and training are critical.
The concern is that we'll catch them too late, and you can die from this disease if it's caught too late.
The CDC estimates valley fever cases are likely in the tens of thousands. The disease has long been misdiagnosed and is often mistaken for pneumonia in Arizona.
When somebody comes to urgent care with a respiratory condition that looks like pneumonia, that you think that valley fever should be tested for, because in fact our data shows that it's 1 chance out of 5 that pneumonia is actually caused by this fungus.
It's one of the reasons the Valley Fever Center for Excellence developed an educational program for doctors.
If you don't diagnose valley fever, all sorts of health care is done which is unnecessary.
The program outlines what doctors should consider when diagnosing a patient. This includes ordering the right test and checking for risk factors. A study from Arizona-based Banner Health showed the overall number of tests that were ordered for valley fever increased significantly after clinics implemented the program.
With training, we were able to improve the frequency that the clinicians at urgent care have been improving looking for valley fever when they should be doing that.
Banner Health also finds training helps reduce treatment cost.
I met a young man who had most of his spine dissolved by the valley fever. He was being held together by pins and needles.
Arizona Representative David Schweikert co-founded the Congressional Valley Fever Task Force, which aims to bring national attention to the disease.
The number of people who come through Tucson or the Valley or even the California desert and may find themselves sitting someplace in New York and there's this funny scar on their lung. How many of the doctors there have ever even heard of valley fever?
In 2022, the congressman helped secure $4.5 million in federal funding for valley fever treatments and vaccines.
It affects almost the entire nation if they have a nexus to us here in the desert Southwest.
While stabilized now, for years, Weinbrenner said his fight against valley fever has made steady work impossible.
That's going to be my mission in life, is to be a good stay-at-home dad until we can get this cured and I can get back in there and start swinging again.
A lifelong fight, Weinbrenner says, cost him an estimated $1 million.
Being your own advocate is huge, because if you don't go in and get the tests, nobody's going to know.
Valley fever is not contagious, but it can lay dormant in your body. The center also stressed the importance of getting tested if you have symptoms, as valley fever can be similar to the flu or COVID-19.
And if you look at the symptoms, cough, chest pain, fever, dyspnea, headaches, joint pain, all of these are the same symptoms that you have or anybody says they have in COVID.
In fact, the center had patients who got multiple negative tests for COVID before finally getting a valley fever test that was positive.
It's not just your health to think about, but your four-legged friend. It's estimated 25% of dogs who get valley fever will become seriously ill, requiring surgery or lifelong treatment. The University of Arizona is working with an animal health company and has developed a valley fever vaccine they say is highly effective and safe in dogs. A study found any symptoms that were seen in dogs who received the vaccine were considered clinically irrelevant because it was so mild. Once the vaccine becomes available, it would be the first time the U.S. has approved a vaccine to protect against a fungal infection in any species.